Ma'am, so start ma'am for 2 minutes.
Yeah. So now coming to why choose Auricle. Auricle comes with various features like recorded classes. And apart from recorded classes, there are even live classes. And then there are practical sessions. There is exam mode.
Ma'am, we can start from start now.
Okay. Hi, everybody. Welcome to this session. In this session, we'll be discussing about toxicology. We'll be discussing about various agricultural poisoning and various corrosive poisoning. Now, coming to agricultural and corrosive poisoning, this is one of the very important topic in toxicology. Lot of 10 marker and 5 marker from toxicology are usually asked from these two topics. And coming to one of the most important questions from this topic, organophosphorus poisoning, it is important not only in forensic medicine, but also in general medicine and pharmacology. And this topic is so important that you might see so many cases of organophosphorus poisoning in day-to-day practice. Be it when in internship or as a general practitioner, you tend to see a lot of cases of organophosphate poisoning because this is one of the most commonly available poison for any farmer if at all he tries to commit suicide. Now, coming to the topics that will be discussed today, we have the long essays. In long essays, we have organophosphorus poisoning, and we will be discussing about the mechanism of action, the clinical feature, autopsy findings in the case of organophosphorus poisoning. The second question is about vitriolage. We'll be discussing about all the corrosive poisons, their classification, diagnosis, management, salient duties of a doctor when a poisoning case comes in. Apart from this, in short essay, we'll be discussing about oxalic acid and nitric acid poisoning. We'll be discussing about the signs and symptoms and management of a case of poisoning with oxalic acid or nitric acid. Coming to the shorts, we'll be discussing about atropine poisons. We'll be discussing about endrin, pralidoxime, carbolism, ochronosis, and even carboluria and oxaluria. Now coming to the app Auricle. So Auricle is a platform which gives you various form of teaching, including recorded classes, live classes, practical sessions, exam module, and even hard copy of the notebook. Now coming to the recorded classes, when it is helpful for people to watch at the comfort of wherever they are in. Be it their home or anywhere they travel to, they can sit and watch through recorded classes. And they can rewatch any topic in case they have any doubt. Coming to live classes, it is curated in such a way that a student attends the class to learn about a particular topic. Here, the important questions from a chapter is discussed so that they know everything what will be coming in the exam. They have an idea as to what are the important things and what were the questions that were asked in previous 10 years. Coming to practical sessions, usually there is a long bridge between actually when practical sessions are taken in your college and when you're going to give practical exams. So to cover it, Auricle has brought practical sessions so that you can go to exam well prepared. Now, coming to exam module, it is curated in such a way that every subject is covered in less than 20 hours so that you can easily revise them. Coming to hard copy books, writing everything is going to be a daunting task. That's why hard copy books comes to your rescue. You can mark all the important points from the hard copy book and you can revise it multiple number of times. And also it saves a lot of time because it is all in the written format already. And coming to the recorded classes, as I told you earlier, it is going to give you a flexible learning experience, that is learn anywhere, anytime at the comfort of wherever you are in. And all the expert educators here give you an actual insight about the subject and how you need to approach the subject. And it is going to be very convenient for you to take up multiple revision, because revision is the key to success. No matter how much vastly you study a topic, if you don't revise it, it is of no use. That is when the recorded classes comes to your rescue. Coming to the live classes, it gives you in-depth coverage of all the important topics which are asked in the previous 10 years, and all the most anticipated questions will be covered here. And all the experienced educators are going to enhance your study skills. They're going to tell you how to answer a question, and they're also going to give you study plans so that you can make use of all this effectively. It is going to be an interactive class where all your doubts are going to be easily cleared. Coming to the express exam module, as I told you, the complete syllabus is going to be covered in less than 20 hours, so that it is going to be an effective way for you to revise it very easily also. And also, they are going to tell you how exactly you need to write an answer to score very well in your exams, be it diagrams, flowcharts. It is going to enhance your answer writing skill in the exam, so that you can get all those extra marks that you wouldn't get because you did not know how to write an answer. Now, all the educators are very experienced. They know exactly what is important and will guide you through it. Coming to one-to-one doubt clearing session, these sessions are curated so that any student shouldn't feel left out. So there are a lot of students who generally don't ask questions in the class thinking that somebody might judge them. So these one-to-one learning sessions are for them so that they can clear all your doubts and make their foundation very concrete. Here, there is a student-centric approach. Personalized attention will be given, and it is also a safe learning environment where you can clear all your doubts. So coming to the hard copy notes, it is going to give you an in-depth coverage of all the important topics and the past year, previous year 10-year question papers, and all the most anticipated topics. All the experienced educators will make your notes so easy for you to understand, and it is also going to teach you answer writing skills and many more. Coming to the question bank is of 3 levels: the beginner, next, and then the last one is going to be the expert level. Start with the beginner level, and once you know that you are through and through with the beginner level, you can always go to the next level. And when you read the expert level, there is no boundary. You have mastered the subject. And it is not only going to help you with the prof exam, it is also going to help you with NEET PG and FMG, because once the base is strong, you can build castles on it. Coming to the practical sessions, there's going to be hands-on experience, and these are also going to be interactive sessions that will simulate real clinical scenarios. You're going to get expert guidance from all the learned faculties here, teaching you about how you need to approach a practical exam. You can revise all these practical classes before you go to these exams. And here, along with explaining you about how a practicals is done, you'll also get an insight about how a Viva VOC is done. Now, coming to the subscription plans that are there at Auricle, you have 4 types of plans. Number 1 is the advanced learning plan. You have complete learning plan, and the last one is the ultimate MBBS plan. Coming to the foundation plan, this is for around 3 months. Here, you're going to get pre-recorded classes, live classes, express exam module, practical sessions, and the Q bank. This is going to be the base of your study. After this, in the advanced learning plan, you're going to get all these for an extended period of 6 months. In the complete learning plan, it is complete, as the name suggests. You even get hard copy of the notes, and there is going to be one-to-one doubt clearing session. Coming to the ultimate MBBS plan, here this is going to be there for 4 years. That is, from the beginning to the end, you are covered with Auricle. Now, coming to the topic per se, this topic is going to cover all the important questions from agricultural and corrosive poisoning. Coming to the first question, it is a 10 marker. Here the question is, to classify organophosphates, you are asked to write the mechanism of action, the clinical features, treatment, and the autopsy findings in the case of organophosphate poisoning. Now, as I told you, this is one of the most common poisoning that you can encounter when you are a practicing physician, because a lot of farmers tend to eat all the herbicides, in the intention to die, and all these contain a lot of organophosphate compounds. Coming to the classification, in classification, you have 2 types. One is the alkyl phosphate, and the other one is the aryl phosphate. Now, in the alkyl phosphate, there are so many types. You have demifox, you have malathion, HETP, tetron, and trichlorphon. Now, coming to exam, I know remembering all these examples would be a daunting task. So try to remember at least 2 important ones. So for alkyl phosphates, you can try to remember demiflox and malathion. Now, coming to the aryl phosphates, here also the examples are parathion, chlorothion, methyl parathion, and diazenol. You can remember parathion and chlorothion because these are the most common ones. Now, coming to what are the modes of absorption of these, it can be either by inhalation, that is through breath, through skin, mucous membrane, or gastrointestinal tract. Now, coming to the mechanism of action. Now, what do these organophosphate compounds do? they inhibit the enzyme acetylcholinesterase in the neuromuscular junction. That is, initially, what happens in these presynaptic neurons. So this is a presynaptic neuron and this is the postsynaptic neuron and this is the synapse. Synapse is where all the neurotransmitters are released. Now, when acetylcholine is released here, it is acted upon by acetylcholinesterase enzyme and it is cleaved so that their action is terminated. But in this, whenever a person eats organophosphate, what happens? All his enzymes are saturated. They are phosphorylated, and that is why they cannot go and act on the acetylcholine. So what happens? The concentration of acetylcholine is going to significantly increase in the synapse. And when they increase, they are going to manifest with various muscular, nicotinic symptoms. And all these acetylcholine accumulates in the parasympathetic, sympathetic, and somatic sites, and they're going to cause various symptoms. Now, coming to what are the clinical features seen here. Number one is the muscular manifestations. Now, muscular manifestation can be remembered by a mnemonic, and the mnemonic is an easy one. It is called as sludge. So, S for salivation. Remember that whenever there is organophosphate poisoning, there is going to be a lot of secretions, okay, from the mouth or from any opening of the body, there are going to be a lot of secretions coming out. So there is salivation, there is lacrimation, urination, defecation, gastrointestinal distress, and emesis. Remember secretions from anywhere. So mouth, when you think of mouth, what do you remember? Salivation, eyes, lacrimation. And when you think about the urinary system, it's urination, like this. Think about anywhere that can lead to excess salivation and write it down under muscarinic manifestations. Coming to the other muscarinic manifestations, coming to the tracheobronchial tree, that is a RS, there is going to be bronchoconstriction and there is going to be increased secretions. Coming to the gastrointestinal tract, again, there is going to be nausea, vomiting, diarrhea, and fecal incontinence. Everything is going to be in excess. So when that person comes to you, he's going to be covered in his own urine, feces. It's going to be a very smelly and very devastating experience to see one of these patients. And when you see that person by the sight itself, you're able to identify that it is a case of organophosphate poisoning. And without any examination also, to 99% certainty, you can say that it is a case of organophosphate poisoning. In sweat glands, there is going to be increased sweating. Next, salivary glands, increased salivation. And coming to CVS, in CVS, there to be bradycardia. This is what you need to remember. So when the muscarinic symptom is asked, remember increased secretions everywhere, and you need to try to remember what is different. The different one is what happens in central vascular system. There is going to be bradycardia. The pumping of heart reduces. Coming to pupils, there's meiosis. So the pupils look very constricted. Coming to the bladder, there is urinary incontinence. That is, he's going to urinate a lot. Okay, he's going to be covered in his urine. Now, coming to the nicotinic manifestations, there is going to be muscular fasciculation. Most of the nicotinic manifestations are those pertaining to the muscular system. There's going to be fasciculations, there's going to be cramps, weakness, and areflexia. That is, if you try to elicit a reflex, you cannot elicit it in these people. And the speech is going to be slurred. You cannot understand what the person is saying. He might be convulsing. And ultimately, if proper treatment is not done, he might go to coma and he might even die. Now, coming to the CNS manifestations, he's going to be very restless. He's not going to understand what is happening. He's trying to do so many things and he's not obeying your command. All these can be seen. The person will have a lot of headache, drowsiness, and confusion. He's not well oriented to time, place, and person. Coming to intermediate syndrome, this is an extra thing, okay? So in the question, they're not asked a subheading of intermediate syndrome, but if you mention something like this in your answer paper, it is always a mark scorer for you. So what is intermediate syndrome? In some cases, after 1 to 4 days, there is weakness of neck, flexors, and proximal limb muscles due to prolonged cholinesterase inhibition. So remember, there is going to be weakness of the neck, flexors, and proximal limb. That is usually what happens immediately after, within around 6 to 12 hours. All these symptoms are seen, and later the person tries tends to improve if proper treatment is given. But in intermediate syndrome, all these symptoms start in 1 to 4 days because the enzyme in this person is inhibited for a longer amount of time. And in this case, the person does not respond to the usual treatment that is given, that is to oximes or even atropine. Now coming to cause of death. The cause of death are things like the paralysis of respiratory system. If the respiratory system, the muscles in the respiratory system are paralyzed, he cannot breathe. So ultimately he's going to die. Or the death could be because of failure of respiratory center, which is there in the brain. Or there could be intense bronchoconstriction, and the person, if he is not intubated in time, he can die because of the SpO2 of his blood will come down significantly. Now, coming to how you can diagnose a case of organophosphate poisoning. As I told you, he'll be covered with his own vomit, feces, and urine. So, as you see, based on signs and symptoms, you are able to identify in around 99% of the cases. Apart from it, you can do this test. You can give 2 milligram of atropine and you can see what happens to patient. Now, 2 milligram of atropine relieves symptoms without atropinizing. So, what is the meaning of atropinizing? Atropinizing is when all the pulmonary secretions are completely dry. In these people, what happens? He has taken organophosphate, and the antidote of organophosphate is nothing but atropine. So when you give atropine, his symptoms are all relieved, and he doesn't get those effect of, like, he doesn't complain of drying of throat or something like that, which could happen in a normal person. And the level of cholinesterase enzyme is going to be less than 50%. This is important. Remember this, because there are only 3 things that can be used to diagnose in most of the cases. These are going to give you the exact diagnosis. Coming to treatment, first you have to remove him from the exposure. You have to remove all the clots. You have to wash him properly with soap and water. Now coming to airway, in airway you need to intubate the person, because there's going to be a lot of bronchoconstriction and the SpO2 would have reduced significantly. So you have to intubate the person so that his oxygen status will improve. Coming to stomach wash. What is the use of stomach wash? It is going to prevent the absorption of the poison from the stomach. Stomach wash can be given using potassium permanganate. So potassium permanganate is a substance that is used for stomach wash in most of the cases of poisoning. If only stomach wash is mentioned, assume that it is going to be potassium permanganate. Only in very few cases, something else is going to be used, and that time specifically that will be mentioned. So the concentration of it is 1:5,000. Now, coming to the other things that can be done here, you can give activated charcoal. By the action of adsorption, it will prevent further absorption of the poison into the body. What is adsorption? It is going to stick in all the poison around its surface so that it is not going into the circulation. Now coming to the atropine sulfate. Atropine sulfate is the antidote of choice in the case of organophosphate poisoning. So atropine is going to reverse most of the symptoms. Mostly all the muscarinic symptoms are going to be reversed, and not the nicotinic one. Only the muscarinic symptoms are going to be reversed, and we can say that the atropine has done all its action when the respiratory secretion stops. Okay. Now coming to one more method of treatment, you can give pralidoxime. So what is pralidoxime? It is a acetylcholinesterase reactivator. That is, it will prevent the aging of acetylcholinesterase. But one thing that you have to remember is, only if the patient comes within 6 hours, you can give this. If not, if it comes after that, the enzyme undergoes something called as aging, and you cannot reverse it then. You can reactivate these enzymes only when the person comes immediately, that is within 6 hours. And if the person complains of convulsion, you can always give barbiturates. If it is not controlled by barbiturates, you can give benzodiazepines. And coming to oxygen, you give it whenever the person is complaining of bronchospasm. If there is intense bronchospasm, the oxygen saturation decreases. That is when you have to give oxygen to the patient. Now coming to what are the autopsy finding, the face is going to look very congested because as I told you, oxygen saturation is less. No, so the face is going to look congested. There's going to be cyanosis of the lips. It's all going to look bluish in color. There's going to be cyanosis in the fingertip. So if you see the person in the finger, there's peripheral cyanosis mostly. In the stomach, when you cut open the stomach during autopsy, there is smell of kerosene that comes out. All the organs, respiratory passage, lung, brain, heart, everything is going to be congested. Along with congestion, now coming to extra things. In the respiratory passage, along with congestion, there are going to be hemorrhages that are seen. What is seen in lungs? Petechial hemorrhages are seen. And coming to brain. The brain is going to be very edematous. Along with being edematous, it is congested. Heart is going to be flabby. And because it is flabby, it is not able to properly pump blood. That is why there is bradycardia in these people. Now coming to the second question. Done with one. Now the second question. Define vitriolized corrosive poison classification, diagnosis, management, salient duties for medical officer with the poisoning case. Now, what does a corrosive poison do? So these are the poisons which will fix, destroy, and erode the surface with which it comes into contact. So wherever it comes in contact, the surface is gone. Remember this much, okay? They act by extracting water from the tissue and coagulate the cellular proteins and convert hemoglobin into hematin. So this hematin gives that reddish black color to the surface with which it comes into contact. Now coming to classification, this is an easy classification you can remember. So two things, there's mineral acid and there is caustic alkali. So under acid you have four. So there are so many ones, but the important things are sulfuric acid, nitric acid, hydrochloric acid, oxalic acid, and carbolic acid. All the 5 markers and 3 markers are also with regard to only these 5 acids. Coming to caustic alkali, you have NaOH, sodium hydroxide, and KOH, potassium hydroxide. Now coming to what are the signs and symptoms that are seen. Now coming to the lips of the person, whoever has ingested this corrosive poison, it is going to be swollen and excoriated. Excoriated is, it is going to be very much damaged. It is going to look like a proper wound. Coming to the mucous membrane, there is going to be corrosion of mucous membrane of the mouth, throat, and esophagus. So wherever it goes, now if the person ingests it, the mouth, throat, esophagus, everything is going to be corrosed. That is, it is going to be damaged. It's going to be wear and tear of these organs. Now coming to the other things, is going to be burning pain and dysphagia. Obviously, no, he's taken acid, so he's going to have that burning pain. If somebody eats lot of chili, even then the person feels like there's going to be so much burning sensation in esophagus. Imagine somebody taking in acid, there is going to be so much burning pain and dysphagia. He cannot swallow anything easily. There's going to be epigastric pain, pharyngeal pain, most common presenting symptom. This is what you need to remember. Pharyngeal pain, because that is the first organ of touch. No, that's why. And there's going to be vomiting and nausea as a reflex. And the vomit that comes out is going to be brown or black. It's going to be mucoid, strongly acidic in nature. The teeth is going to be chalky white because the calcium reacts with the acid, and at the end, a chalky white teeth is formed. Tongue becomes swollen, sodden, black. What is soddening? Soddening is, it is very soft and macerated. That is called as soddening. Constipation is severe and there is tenesmus because all the bowel movement is hampered. He feels like going to the washroom, but then he cannot evacuate his bowel completely. That is the meaning of tenesmus, incomplete evacuation of the bowel. The voice is going to be hoarse because all his glottis and the voice box, everything is going to be damaged severely. And if the person recovers, late esophageal, gastric, and pyloric strictures and stenosis may develop, because once all these surfaces are ragged and when they try to heal, there is going to be contact between the surfaces. Now, for example, if this is the esophagus, imagine this part is corrosed. And when healing occurs, there are going to be connection between these two, and that is how the stricture is formed. Coming to causes of death, it could be either by circulatory collapse, there is going to be hypovolemia or toxemia, or there could be collapse to perforation of stomach. Any major perforation of an internal organ will lead to lots of torrential hemorrhage and the person will ultimately die. Coming to the complications include perforation of stomach, because the surface is going to be very smooth, no, so it can perforate easily. There is going to be stricture formation, infection, and renal failure, because the blood which gets lysed releases compounds which can go and cause acute tubular necrosis and hence renal failure. Coming to the treatment, we have to avoid gastric lavage or emetics, because these will cause all these poison to go into the respiratory tract. That is how the person can go into pneumonitis and die. The acid should be immediately diluted. 1/4 liter of water or milk, or even milk of magnesia, can be given. So this is one important point that you need to tell everybody that is there in your house or to any of your friends. In case somebody in their home or somebody takes in the poison, or by mistake if they consume something, what to do? If they have milk or if they have any of this milk of magnesia or milk, they need to consume it, and not in a very little quantity. You have to give in like 1/4 liter or something, so that these poison can get neutralized at least to a little extent and the damage can be prevented little. Give a demulcent. So demulcent are those substances which are easily available at home, mostly in your kitchen, like milk, egg white, mineral oil, and melted butter. So what do these do? They form a coating in your esophagus and your stomach so that absorption of these poison do not take place. And you can give prednisolone 60 mg per day, and it has to be given in divided doses, and it will prevent the formation of esophageal stricture and also shock, because there's going to be hypovolemia in these patients. And whenever you give prednisolone, it will prevent formation of it will prevent the person from dying from shock. Mercury-filled boogie should be passed daily if stricture develops. So imagine a stricture is developing. How, as I told you, if this is the esophagus, when a stricture develops, so this is the ragged surface, and the stricture is going to be formed like this between the surface. And when stricture is formed, the connection, the entire opening is closed, and the person henceforth would not be able to eat. That is when you will be giving. Whenever you pass a boogie, it is passed like this. So every day when you pass this, what happens? It is going to slowly dilate your esophagus, so the stricture doesn't form. Now coming to what are the other steps of treatment. Correct the circulatory shock. That is, I told you there will be hypovolemia. You have to give a lot of fluids to these patients. And coming to next step, you have to do tracheostomy. Whenever there is edema in the glottis, the person cannot eat, he cannot swallow, he cannot talk. Tracheostomy will help him. It is also going to help him get enough oxygen. You have to not give anything by mouth, because anyway all his entire GIT is going to be sawed in and corrosed and damaged. So if you give by mouth, in case he has something left, it is going to tear apart it also. So all the nutrient substances are given by intravenous route. A parenteral nutrition is taken, should be given so that the person can feel better. Parenteral nutrition. You'll study more about parenteral nutrition in your surgery in your final year. Coming to the next one, all the skin burns and eye burns are washed with large amount of water so that whatever remaining acid is washed away. And then the paste of magnesium oxide or sodium bicarbonate is applied on the skin. That is the treatment method. Coming to what are the post-mortem appearance. Externally, there's going to be corrosion of mucous membrane of the lips, mouth, throat, and skin over the chin, angle of the mouth, and the hands. So wherever an acid or a caustic alkali has, there is going to be corrosion. It's going to look blackish, excoriated. It looks like a wound. And these necrotic areas are at first grayish white, but soon becomes brown or black. As the hematine deposition increases, it's going to change its color to brown or black. Now coming to what are the internal findings, the upper digestive tract is inflamed and swollen. Severe intestinal hemorrhages is seen. Perforation of esophagus is rare, but then it is going to become very tender, and it can rupture easily when an attempt to give an emetic or when the person attempts to eat by himself. Therefore, those things should be avoided. Stomach may be converted into a soft, spongy black mass. Pathway for esophagus occurs usually along the lesser curvature, and it is called as Mejen's-Truss. So what is Mejen's-Truss? Now, this is how your stomach is going to look. So this in the stomach, this is the larger curvature of the stomach, and this is the smaller curvature of the stomach. So usually when a person eats food, it is going to flow through the smaller curvature and then it goes to the pylorus. And whenever only solid foods are taken, that is when the food will go here. Any liquid food is going to pass through the lesser curvature only. So this part will get corroded, and this part is called as Mejen's-Truss. Understood? Okay. Coming to the other findings. Perforation may occur with the escape of gastric contents into peritoneum, causing chemical peritonitis. It is very obvious, right? Whenever any acid or a foreign substance enters our peritoneum, there's going to be inflammation leading to chemical peritonitis. So this is one important point that you'll have to mention in the exam. Other things are perforation of diaphragm may occur. If there's irritation or perforation in the diaphragm, there's going to be shoulder tip pain also. Corrosion and severe inflammation of the larynx and trachea present. Therefore, that's why the person cannot talk. He'll have even difficulty in swallowing even sips of water. Now coming to the 5-marker questions. Oxalic and nitric acid poisoning, signs and symptoms, management and treatment. So as I told you earlier in the classification, there are 5 acids that are important. So we'll be covering 2 important ones here. And remember that for most of the acid cases, the postmortem findings are going to be similar. The signs and symptoms are going to be similar. So you read about one. Like for example, the sulfuric acid is the first acid that is given. Read about it. And for all the remaining ones, try to learn only the important ones so that it will be easier for you to revise. Coming to the oxalic acid poisoning, first you write what is oxalic acid. This is going to fetch you an extra mark probably. Okay. So oxalic acid appears in the form of colorless, transparent crystals. That's all. Very basic, simple statement stating what is oxalic acid. Now coming to the action of oxalic acid, the local action is it easily corrodes the mucous membrane. Systemic action, large doses will cause shock. There is going to be hypocalcemia. Why there is going to be hypocalcemia? Because this oxalate, which is there in the oxalic acid, combines with the calcium in the body and it is going to form calcium oxalate. And because every calcium is complex in the form of calcium oxalate, their amount reduces in the serum. There's going to be renal damage. There is going to be acute tubular necrosis. Now coming to what is the fatal dose in oxalic acid poisoning. It is around 15 to 20 gram. Now this 15 to 20 gram, it is also universal for most of the acids. Okay, remember, as little as 10 gram is enough to cause damage. So for any acid, if you do not exactly remember how much it is, you write around 10 grams because that is the basic amount that is required to cause damage. And the fatal period is around 1 to 2 hours. Coming to signs and symptoms, as you can see in the picture here, this is how a coffee colored vomit looks like. What is a coffee ground vomit? It is nothing but, see, whenever a coffee bean is roasted and a powder is made and you mix it with a little water, whatever color it appears to be, that is how a coffee ground color in vomiting looks like, and it is exactly this. Other signs and symptoms include burning sensation and bitter taste in mouth. There's going to be severe epigastric pain, tenderness over abdomen. So in the previous, when I explained about general case of poisoning by corrosive, these were the same signs and symptoms because these corrosive substances are such that when they pass through the GIT, the symptoms that are produced are same for everything. So you try to remember for one and you can build up on it on the other acids also. Whenever there is acute poisoning, there is going to be tetany because the calcium levels come down. So there's hypocalcemia causing tetany, muscle tenderness, tingling in the fingertips and legs. So whenever the level of calcium or magnesium comes out or all these important ions comes, there's going to be tingling sensation is explained in the point. Chronic thing that can be uremia, scanty urine discharge, metabolic acidosis and ventricular fibrillation. Now, why scanty urine discharge? It is because there is renal tubular necrosis. Why renal tubular necrosis? Because the breakdown products of hemoglobin will go sit at the tubules and it is going to damage these tubules. Coming to the treatment, gastric lavage, it can be done with calcium lactate or gluconate. Calcium lactate because it is going to replenish all the calcium reserve as well as it is going to form complexes with the oxalate so that your body's calcium is going to get freed up. Antidote, usually calcium gluconate at frequent intervals, which converts oxalate into insoluble form. Dialysis is done if the renal failure occurs. And parathyroid extract can be given in severe cases. This point is actually obsolete now. It is not done, but remember that how this can help. Now, what is the function of parathyroid? Whenever the levels of parathormone increases in the body, it will cause resorption in the bone. It will cause increased absorption of calcium. So basically in serum, calcium level improves. That is the essence of giving parathyroid extract. It was done in older days so that the calcium levels get maintained in the body. And symptomatic treatment, obviously. Now, whenever somebody asks about what is symptomatic treatment, for any question, you can write it. It is about treating whatever happens. If there is a secondary infection, you treat it. If he has a temperature, you treat it. Airway, you secure airway, breathing, circulation. So all these comes under symptomatic treatment. If there is hypovolemia, you give fluids. Such things can be mentioned under symptomatic treatment. If you don't have time, just write symptomatic. If you have time, explain 2 to 3 lines under it. Coming to the post-mortem appearance, mucous membrane of the tongue, mouth, pharynx, esophagus, that is basically the GIT, is bleached and there is a scalded appearance. What is that scalded appearance and bleached? That when you look at it, it's going to be very pale and it is going to look like a very ragged surface. Like when you look at it, it's going to be very severely injured appearance is going to be seen. In the stomach also, the mucous membrane is reddened with punctate erosions. That is, it is going to be reddened like this, and there are spots of hemorrhages that will be seen. The kidneys, there is edema and congestion, and there is also congestion of other internal organs. So congestion is a common feature seen in all the organs when a case of poisoning comes. Coming to the next one, nitric acid poisoning. Now, as I told you, first you need to write about what is nitric acid. Just one simple point about it. It is a clear, colorless, fuming liquid with a choking odor. Now, coming to what is its action. It combines with organic matter and produces a yellow discoloration of the tissue because of the production of picric acid. And this process is called as xanthoprotic reaction. Write it and underline xanthoprotic reaction. See, this is a test tube which contains certain organic matter. When you add nitric acid into it, it is going to convert to this orange colored picric acid, and this process is called orange color because of picric acid, and this process is called as xanthoprotic reaction. It happens whenever nitric acid reacts with organic substances in the body. So there is going to be yellowish orange discoloration of all the internal organs. That is, signs and symptoms are those similar to sulfuric acid. So basically what I mean to say here is, for all the acid poisoning, the signs and symptoms are almost similar. You remember what happens in GIT, and then you can explain what happens to other internal organs. You can explain about the pain. You can explain about the reflex vomiting and nausea that is seen, and about the hypovolemia. There is more abdominal distension due to the formation of gas in case of nitric acid poisoning. Yellow discoloration of the tissues, including teeth, that is because of the xanthoprotic reaction. And coming to the other thing, there is going to be inhalation of the fumes. It causes lacrimation, photophobia, irritation of the air passages and lungs, sneezing, coughing, dyspnea, and asphyxia. The fumes are going to be very harsh. Okay, so whenever very harsh thing, even for as little as dust or smoke, we tend to lacrimate. No, so imagine something what happens with the fumes of a pungent acid like nitrous acid. There's going to be lacrimation, photophobia, that is irritation of the eyes, air passage, cough, dyspnea, everything. The color of urine will be brown. That is, initially to be yellowish, and because of xanthoprotic reaction, later brown. And also the brown color is because of the lysed hemoglobin. There is going to be hematin formation and brown color therefore. And here also see fatal doses 10 to 15 ml. I told you in the previous question, right? 10 gram. Around 10 gram is the fatal dose. You can write this. Treatment, same as that of sulfuric acid. You have to give a stomach wash. You have to use activated charcoal. You have to look into it that the fluid status in the body is right. So these are the basic things that you will do. And obviously the symptomatic treatment. Postmortem appearance, these are again here also the same things. Whatever I had explained for this organic acid poisoning, you are going to mention the same thing. Let me take you to that page. See, you have to give any of the things like milk or milk of magnesium so that the acid content in the stomach gets diluted. You can give a demulcent like milk, egg white, mineral oil so that it forms a protective cover and the further absorption is prevented. And prednisolone 60 mg can be given to prevent shock, and mercury filled bogey can also be given. And coming to the other postmortem appearances, there is going to be corrosion of the mucous membrane of the esophagus and stomach. It is going to look brown or black color because of the formation of acid hematin. The stomach is soft, friable, ulcerated. Perforation of stomach occurs in severe cases. In deaths from inhalation of fumes, the larynx, trachea, and the bronchial tubes are congested. Any poisoning case, most of the symptoms are seen in the GIT itself, including all the glottis, trachea. The RS and GIT symptoms are the predominating ones. Okay, so that brings us to the next set of questions where we'll be discussing about the shots. In shots, the first question is about atropine poisoning. And Initially, I told you that atropine is an antidote for organophosphate poisoning. But per se, if a person takes too much atropine, that can also act as poisoning. And whenever he takes it, you remember this mnemonic. He is going to be hot as hair, mad as hatter, red as beet, and dry as bone. Along with that, he is going to have blindness. That is because of pupil dilatation. Why he is going to be hot as hair? Because of increased body temperature. Mad as hatter, because he's going to be very confused. He's going to act like a lunatic. Red as a beet, because there is going to be flushing of the skin. Dry as a bone, because there is going to be decreased sensation. In organophosphate poisoning, increased sensation, secretions everywhere. But in atropine, exact reverse. Dryness, decreased secretion everywhere. He's going to be very, very thirsty. He'll be, wanting even sips of water. He'll be like, gimme, 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 because he's going to be very thirsty. And then there's pupil dilation, because of which the person will have sensation of blindness. Same things here also. Hyperthermia, vasodilation causes flushing, decreased salivation, decreased lacrimation, mydriasis, cycloplegia, so that because of which he'll have the sensation of not able to see anything. In CNS, he'll have excitation, he'll have hallucination, delirium, convulsion. Therefore, he is called as a hatter. Who is a hatter? Hatter, if you have watched Harry Potter, you'll be familiar with the hatter, right? Same thing. The lunatic person who has a hallucination and all that. Tachycardia and constipation, because the bowel movement is going to be slowed. Same, urinary retention, because the muscular activity is slowed. Coming to the treatment of atropine poisoning, hospitalization, gastric lavage with tannic acid if poison was ingested. See, that's what I said. When only if gastric lavage is mentioned, it means that you give potassium permanganate. That is used in 80% of the cases. If not, specifically it will be given. So in this case, tannic acid. So this is what you have to make note here. Tepid sponging to control hyperpyrexia. He's going to be very hot. You take cold water and give him that sponge bath. Diazepam is given to control convulsions, and the antidote here is physostigmine. It is a drug of choice. How much physostigmine is given? It is around 1 to 4 mg. This physostigmine is going to counteract both the symptoms of peripheral and central effects of atropine poisoning. Now coming to the next question. It is a shorts to write about endrin and pralidoxime. So what is understood? Usually a short is for how much? 3 mark. No. So endrin will give you 1.5 mark and pralidoxime 1.5 mark. So mostly you have to write 3 points for each. Specific points will give you specific marks. You write 3 proper points, you are going to get 1.5 mark for endrin and pralidoxime each. Now coming to the endrin, the action. They are anticholinergics and inhibit carboxylic esterase enzyme by carbamylation. So whenever you write it, it is a very specific point. You're specifically telling what it will do. No, so it will fetch you that mark. Now coming to what it is. It is a polycyclic polychlorinated hydrocarbon. It is also called as plant penicillin. Coming to symptoms, salivation, nausea, vomiting, abdominal pain, and diarrhea. These are the GI symptoms. There's going to be cough and dyspnea, RS symptoms, irritability, headache, and confusion, convulsions, and coma, and death if not treated properly. The fatal dose here is around 5 to 6 gram. Fatal period 24 hours. So this fatal dose, it is important for you to mention about fatal dose when they ask you a 5 marker or a 10 marker question, because they'll want you to answer in depth. For a 3 marker, it is okay if you do not write it also. What is the treatment? No specific antidote. You give a gastric lavage. What is it done with? I told you earlier, no, if it's not mentioned, it is usually potassium permanganate. Clothing should be removed and the skin washed so that further exposure is prevented. Convulsions is treated with diazepam. It is an anti-epileptic, and whenever there is altered mental status, you try to treat everything. Like if there is fluid, if the person is less on fluids, you give fluids. You try to check his temperature. If there's hypothermia, you correct it. And then if there is any imbalance in the status of any ions in the body, like sodium or potassium, you correct even that. Postmortem appearance in the stomach, there's going to be smell of kerosene, and there's going to be signs of asphyxia in all the organ. So this specifically tells us the answer. Coming to the second part, pralidoxime. So what is pralidoxime? It is used in case of organophosphate poisoning along with atropine. So pralidoxime and atropine work synergistically. That is, both of them work together and they are to be used together. The function of oximes is they reactivate the inhibited cholinesterase, remove the block at the neuromuscular junction, and prevent formation of phosphorylated enzyme and directly detoxify organophosphate. They are the reactivators, but remember, they can be given if the case comes within 6 hours. If they come very late, then aging of enzyme happens and giving pralidoxime is of no use. They do not cross the blood-brain barrier, so CNS symptoms are not reversed with pralidoxime. They should be started as early as possible, although they may be beneficial when given after 24 to 36 hours, but this happens in very less amount, like maybe in less than 10% of people. They are given until the patient is clinically well and not requiring atropine. I told you, atropine and pralidoxime, they have a synergistic role. You have to always give them together. Pralidoxime decreases the amount of atropine required and also potentiate the action of atropine. So it is the best friend of atropine. Oximes are ineffective or minimally effective for other types of poisoning, like demifox, demethuvate, or ceodin. It is difficult to remember all these names. You just remember that it is not very effective when treating any other type of poisoning, like organochlorines or all that. Coming to the next question. What is carbolism and what is ochronosis? First, remember where both of these are seen. Both of these are seen in carbolic acid poisoning. Coming to carbolism, it is nothing but poisoning by carbolic acid. Local symptoms of burning and numbness is seen because it is a corrosive. There's going to be burning sensation and all the nerve ends get damaged, so there is going to be numbness. There's going to be a white eschar formed, which is painless. So what is an eschar? Eschar is a superficial layer. Now imagine you put acid on the skin. So the superficial thing that is seen is an eschar. Now, what are the systemic features? Now, what I told you, remember that it's a carbolic acid poisoning. No, so where is carbolic acid found? It is found in phenol. What is phenol? This is used for at homes to clean the toilets or commodes. No, so a lot of people consume that in order to die or commit suicide. So when that happens, the systemic things are mainly depresses the central nervous system and the respiratory system. So they'll not be very oriented to time, place, and person. Plus, they'll have breathing difficulty. Along with it, the other things are whenever a huge amount of phenol is consumed, there's going to be cyanosis, respiratory alkalosis, and metabolic acidosis, which are seen. Coming to ochronosis, that is also seen in carbolic acid or phenol poisoning. What happens here? There is a compound which is called as hydroquinone pyroceticol. This compound is formed by the oxidation of carbolic acid, and this causes pigmentation in the cornea and various cartilages. So when you see this person, the cornea is going to look little blackish, and other cartilages like the nose, this cartilage is going to look little blackish. So classically, ochronosis is seen in the case of alkaptonuria. It is a condition where homogenesic acid gets deposited in cartilage, ligament, and fibrous tissue. Same is seen in the case of phenol poisoning also. So when you see this patient who has consumed phenol, don't also suspect alkaptonuria. One of the things that happen in phenol poisoning could be ochronosis and not alkaptonuria here as a cause. Coming to the last question of today, carboluria and oxaluria. So here also each question has 1.5 marks. What is carboluria? It is seen in carbolic acid poisoning. Here, when this carbolic acid is finally excreted through the urine becomes very scanty because the kidneys are very damaged. No, that's why. And this kidney also contains albumin and free hemoglobin. And the urine is going to be colorless at first, and later it turns green because of exposure of air. The compound gets oxidized and it is going to look green because this gets oxidized to certain compounds like hydroquinone and pyrocaticol, which causes green coloration. And when these deposit in the cartilages, it simulates alkaptonuria because it is going to give that discoloration both in the cornea and in the all the cartilages, and it is also called as ochronosis. Coming to the second part, oxaluria. Oxaluria it is seen when the person consumes oxalic acid. In the case of oxalic acid poisoning, oxalates produce tubular necrosis and cause death from uremia. Any poisons, whenever they break down hemoglobin, the compounds that are formed by breakdown of hemoglobin will grow and it is going to sit in the tubules of the kidney. And then it is going to affect it, finally causing tubular necrosis. And whenever tubular necrosis happens, the amount of urine passed will decrease. And at the end, finally, there is also going to be uremia. The urine may be scanty or suppressed initially to begin with, and it also contains traces of albumin, calcium oxalate crystals. Because as I told you earlier, the oxaluria means oxalic acid poisoning. Oxalate combines with calcium to form calcium oxalate, and that is excreted in the urine. And along with it, because it is acidic poison, metabolic acidosis is also seen. So this is all about it that I had to explain today. Remember, these two topics are very important because a lot of 10 marker and 5 marker come from here, and 3 markers are very expected ones. Usually they come in parts of 2, so that if you know 3 specific points, it is going to fetch you all that marks. I hope you enjoyed this session, and thanks for watching. And download the app to get more useful classes like this and help you ace your preparation for your board as well as NEET and next exam. Thank you.